Welcome back to Wally's nursing videos. Today, we'll discuss a critical condition, alcohol-induced liver cirrhosis with hemorrhagic shock. We'll break down the pathophysiology, discuss nursing care plans, and cover medications and diagnostics. This is a vital topic, especially for nurses working in acute care settings. By the end of this video, you'll be able to explain the effects of alcohol on the liver and how it leads to cirrhosis, understand the complications of portal hypertension and hemorrhagic shock, plan nursing interventions to slow the progression of liver damage, analyze medications and diagnostics that help manage this condition. Let's get started with our lesson. Pathophysiology of alcohol-induced liver cirrhosis with hemorrhagic shock. Let's start by breaking down the pathophysiologic features of alcohol-induced liver cirrhosis and how it can lead to hemorrhagic shock. Alcohol's effect on the liver. Chronic alcohol consumption damages liver cells through a process called oxidative stress. Alcohol metabolism produces toxic byproducts like acetaldehyde, which causes inflammation and fat accumulation, steatosis, in liver cells. Over time, this leads to steatosis, fatty liver. Early stage, reversible with cessation of alcohol. Fibrosis, scar tissue replaces healthy liver tissue due to chronic inflammation. Cirrhosis, the liver's architecture becomes severely distorted, and scar tissue obstructs blood flow through the liver. The process of liver damage. As the liver tries to repair itself, scar tissue, fibrosis, forms, disrupting its normal functions, such as metabolizing nutrients and detoxifying the blood. Cirrhosis is the end stage, where irreversible scarring leads to a loss of liver function. Portal hypertension. As scar tissue builds up, blood flow through the liver becomes restricted, causing portal hypertension. This increased pressure in the portal vein leads to dangerous complications, such as esophageal varices, dilated blood vessels in the esophagus that can rupture and cause life-threatening hemorrhages. Ascites, fluid buildup in the abdomen. Splenomegaly, enlargement of the spleen due to backflow of blood. Metabolic derangements and loss of vitamin storage. The damaged liver cannot properly store essential vitamins, leading to deficiencies, especially vitamin K, which is necessary for blood clotting. Ammonia buildup leads to hepatic encephalopathy, causing confusion and altered mental status. Loss of albumin production results in hypoalbuminemia, causing fluid shifts and edema. Hemorrhagic shock. If a patient with cirrhosis experiences a variceal rupture, they can enter hemorrhagic shock. This is a form of hypovolemic shock, where the body loses a large amount of blood, leading to decreased blood pressure, organ failure, and, if not treated promptly, death. The patient presents with rapid heart rate, tachycardia, low blood pressure, hypotension, cold, clammy skin, altered mental status due to poor perfusion. Key learning. Point 1. Chronic alcohol consumption leads to liver cirrhosis through the accumulation of scar tissue. Portal hypertension from cirrhosis causes dangerous complications like esophageal varices, while the liver's loss of vitamin storage and metabolic function increases the risk of hemorrhagic shock. Nursing care to reduce disease progression. Next, let's talk about how nurses can slow the progression of liver cirrhosis and manage hemorrhagic shock. Here are vital interventions. Monitor and manage bleeding risks. Patients with cirrhosis are at high risk of variceal bleeding due to portal hypertension. Nurses should assess for signs of active bleeding such as hematemesis, vomiting blood, or melena, black tarry stools. Administer vitamin K or fresh frozen plasma if needed to improve clotting. Prepare for blood transfusions if hemorrhagic shock occurs. Fluid and electrolyte management. Due to fluid shifts caused by low albumin and portal hypertension, patients often have ascites and electrolyte imbalances. Nursing interventions include administering diuretics like spironolactone to reduce fluid retention and manage ascites. Monitoring electrolytes, sodium, potassium, closely, especially in patients on diuretics. Nutritional support. Patients with liver cirrhosis are often malnourished. Nurses should collaborate with a dietitian to provide the following: a high-protein diet, unless the patient has hepatic encephalopathy, in which case protein intake should be reduced. Vitamin supplements, particularly B vitamins and vitamin K. Prevention of complications. Administer beta blockers like propranolol to reduce portal pressure and prevent variceal bleeding. Monitor for signs of hepatic encephalopathy, confusion, agitation, and administer lactulose to reduce ammonia levels. Hemodynamic monitoring. In patients with hemorrhagic shock, continuous monitoring of vital signs is crucial. Check for signs of hypoperfusion, cool extremities, decreased urine output. Monitor blood pressure, heart rate, and oxygen saturation. Administer IV fluids and vasopressors if needed to maintain blood pressure. Key learning point 2. Nursing care should focus on reducing the risk of variceal bleeding, managing fluid shifts, optimizing nutrition, and monitoring for signs of hepatic encephalopathy or hemorrhagic shock. Impact of medications and therapeutic interventions. Let's now discuss some of the key medications and therapeutic interventions used in patients with alcohol-induced cirrhosis and hemorrhagic shock and where they act on pathophysiology. Beta blockers, propranolol. These medications reduce portal hypertension by decreasing the heart rate and lowering portal pressure, reducing the risk of variceal bleeding. They act at the point of portal hypertension. Diuretics, spironolactone. They are used to manage ascites by promoting the excretion of excess fluid. These act by reducing fluid retention caused by hypoalbuminemia and portal hypertension. Lactulose is given to treat hepatic encephalopathy by promoting the excretion of ammonia. This addresses the metabolic derangement caused by the liver's inability to detoxify ammonia. Vitamin K and fresh frozen plasma. They are given to improve blood clotting in patients with coagulopathies due to cirrhosis. These interventions directly address the loss of clotting factors stored in the liver. Vasopressors. If hemorrhagic shock develops, vasopressors like norepinephrine may be needed to maintain blood pressure and perfusion. These address the systemic effects of hypovolemic shock. Key learning point number 3. Medications like beta blockers reduce portal pressure, diuretics manage ascites, lactulose treats hepatic encephalopathy, and vasopressors support hemodynamic stability in hemorrhagic shock. Diagnostic tests and lab results. Nurses must interpret key diagnostic results in patients with liver cirrhosis and hemorrhagic shock. Here's a breakdown of the most essential labs and diagnostics. Liver function tests, LFTs, ALT, 756 UL, and AST, 1040 UL, elevated in early liver damage. Albumin, 355 DL, low in cirrhosis indicating impaired liver function. Bilirubin, 0.11.2 mg, elevated in cirrhosis due to the liver's inability to process it. Coagulation studies, prothrombin time, PT, prolonged in cirrhosis due to reduced production of clotting factors. NR, 1.1. Elevated, indicating impaired blood clotting. Complete blood count, CBC. Hemoglobin, 13.500 GCAUS-DL for men, 12.015.5 GCAUS-DL for women. Low in hemorrhagic shock due to blood loss. Platelets, 150,000 and 450,000 AUS-MCL. Low in cirrhosis due to splenic sequestration. Splenomegaly. Ammonia levels, ammonia, 1545 umol-L, elevated in hepatic encephalopathy. Ultrasound or CT scan imaging may show ascites, splenomegaly, and nodular liver, which indicates cirrhosis. Endoscopy is used to visualize and treat esophageal varices. Key learning point 4. LFTs, coagulation studies, CBCs, and ammonia levels help assess the severity of liver damage and complications, while imaging can reveal physical changes like ascites and varices. Conclusion: that wraps up our discussion on alcohol-induced liver cirrhosis and hemorrhagic shock. Nurses must understand the pathophysiology, plan appropriate care, and use diagnostic results effectively to improve patient outcomes. Thanks for tuning in to Wally's nursing videos. Please like, subscribe, and hit the notification bell so you never miss out on our latest content. See you next time.